Thank you for joining us for HeForShe, Pathways to Leadership Success, hosted by the American College of Surgeons Women in Surgery Committee and the International Relations Committee. I have the pleasure to introduce Dr. Tanaz Ferzandi, our moderator for today's discussion. Dr. Ferzandi is the Director of Urogynecology and Pelvic Reconstructive Surgery at the University of Southern California, an Associate Fellowship Program Director for Urogynecology, an Associate Professor of Obstetrics and Gynecology, and the Service Line Chief of Obstetrics and Gynecology at the Keck Hospital of University of Southern California. She is a fellowship trained and board certified in female pelvic medicine and reconstructive surgery, obstetrics and gynecology, having completed her residency and fellowship at Beth Israel Deaconess, Harvard Medical School in Boston. She is a national board examiner for the General Gynecology Boards and the Urogynecology subspecialty board exams. Dr. Ferzandi is a reviewer for the Obstetrics and Gynecology Journal. She also serves as Director at Large for the American Urogynecologic Society Board of Directors and as Council Chair for Practice Management, oversaw Coding and Reimbursement Committee and the Payment Reform Committee. Among her many interests, she is passionate about gender equity in surgical subspecialties and working to promote clinical care at all levels to ensure physicians have strong women in the field as role models. She currently serves as co-chair of the Salary Equity Subcommittee within the Center for Gender Equity in Medicine and Science at the Keck School of Medicine. Dr. Ferzandi is a fellow of the American College of Surgeons and serves on the Women in Surgery Committee and as the WISC International Subcommittee Chair. Thank you, Dr. Ferzandi, for moderating our webinar today.
Thank you all for joining us today for HeForShe, Pathways to Leadership Success. Today's webinar is part of the ACS HeForShe series. HeForShe is a United Nations global solidarity movement inviting men and people of all genders to stand in solidarity with women to create a bold, visible, and united force for gender equality. HeForShe aims to systemically change gender inequality and increase the empowerment of women. Today, we continue to engage in the HeForShe movement and focus our discussion on women surgeons in leadership positions. While progress has been made in the number of surgeons who identify as women serving in leadership positions, barriers still exist in a myriad of settings. We are joined today by Dr. Sandra Wong and Esmel Rashed. Today, they will share how they created their personal pathways to leadership roles, as well as the challenges and barriers they faced in pursuing leadership as a woman surgeon. We welcome Dr. Esmel Rashed, Assistant Program Director of the Surgical Foundations Program at the Kuwait Institute for Medical Specialization and Faculty of Medicine at Kuwait University. She is a general and bariatric surgeon, intensivist in critical care and anesthesia at Asmaa Hospital in Kuwait. Her research and clinical work focuses on the standardization of the care of patients with obesity and bariatric and metabolic surgery, where she has established and led multiple quality improvement projects. Dr. Rashed is a fierce advocate for empowering women in surgery. She is the founder and chair of the Women Surgeons Committee for the Kuwait Association of Surgeons and has championed the historical documentation and led many activities in tackling gender equity in surgery in the Gulf and the Middle East. She's a co-founder of the Women Surgeons of Kuwait Research Network that has encouraged and created research opportunities for many surgeons, physicians, and students. Under her leadership, the WSKRN has spearheaded the production of clinical guidelines during the COVID-19 pandemic and has conducted research, educational, and learning activities. Dr. Rashed is a fellow of the Royal College of Surgeons of Canada and a fellow of the American College of Surgeons. Thank you, Dr. Rashed, for being with us today to share your story.
I'd like to thank the American College of Surgeons for having me here today to share my experience with you. And I know there are a lot of great leaders in Kuwait and in the Gulf country and in the world who could have been here in my position today. So for that, I'd like to say thank you. Today, I'll be sharing with you my evolving story, I would say. I hope through sharing this that I'll go over some of the personal milestones that actually changed me on for me and made me the person who I am today, and helped me to pave my way in my surgical career. So I don't have slides today. I'll be just having this talk with you. So after I did my undergrad outside Kuwait, and came back for Kuwait for like about a year to do my internship, and after that get into my scholarship, and went and traveled to Canada to pursue my residency. As being a surgeon was a dream of my life since I was like a 12-year-old. When I started in there, one of the challenges that I have, or some of the challenges that I have there, of course, going into a new culture, in a new program, in a new city, and then unexpectedly got pregnant. My husband at that time, he had just got accepted in another program, which is about 5 hours away from me. So that kind of challenge was really difficult, to be there alone in a country that you don't know anybody there. And then going through the residency, as we all know, it's not an easy thing to maneuver. So going through that, then going into my fellowships and having another child, and then my second fellowship that required me to take the train back and forth 3 hours from Montreal. All these things actually made an impact on me. Motherhood itself, I think, changed me and made me a better physician, a better surgeon, a better communicator, and so forth. And then I did have a great program with a supporting program director, both in general surgery and as well in my fellowship. So, and I think that kind of experience added to me so much. When I came back to Kuwait and started to go back and assume my role as an attending, here where I started to have also different kind of challenges that I will share with you today. So just an important point to highlight here, just because of the audience could be from United States or anywhere else, it's important to highlight the differences in the healthcare system and the medical education that someone who would be coming from a different country or working in a different area that could alter their path. So for example, Kuwait is a very small country. Our population is about 4.5 to 5 million. And then the healthcare system, basically the Ministry of Health govern, organize, set the goals, monitor, and the whole load is there on the Ministry of Health. Now, the Ministry of Health deliver the care through administrative 6 regions. And then there are other stakeholders such as the private sector and the Ministry of Oil and Defense. When we talk about the medical education, and that's a bit different from, for example, other countries, the 2 academic institutions are Kuwait Institution for Medical Specialization, as well as Kuwait University Faculty of Medicine. So Faculty of Medicine responsible for training the medical student, whereas KIMS is responsible for the postgraduate training as well as education. Now, these 2 academic institutions they do not own a hospital. So most of the training, or people who are involved in the training, actually are not actually a faculty. Now, just to give a brief, it's important to understand that when you come back from a different system, this could pose an issue, and not even understanding that structure until later on. So one of the things that I have faced personally is understanding the promotional system and how things work. There's a lot of bureaucracy, a lot of issue when it comes to using the power dynamic, sometimes misuse of power dynamic that the system would allow, as well as having a hierarchy within a hierarchy. And that complicates the clinical role of a physician, and as well as the responsibilities. And this by itself creates a bit of a difficult environment when it comes to establishing and developing collegial relationships. So these are some of the challenges at the beginning when I get back there. The lack of, having a research center and a library as well that, could take in some of the aspiration that you would have, not having a working space, for example. So these are some of the challenges at the beginning. Now, through that, my focus was to try to excel in my clinical practice and try to focus more on my clinical clinical roles. And that, identifying the gaps that are there, starting to work on quality improvement projects, pushing things forward from that perspective, and then building relationship and working within the hospital itself allowed for a little bit of a progress there. And now, while doing that as well, they're teaching the resident, as I said, because they do come into the governmental hospitals to get their training. That kind of involvement open more academic opportunities. As you already mentioned earlier, being the assistant program director and also being involved in other programs, teaching the resident as well as the medical student. Now, moving from that, I want to tell you that one of the important things that I cherish and I really feel proud of is actually the foundation of the Women Surgeons of Kuwait. And I'll tell you the story about that, because sometimes we do take small decisions in our life that we do not really maybe think at the moment the impact of these decisions. So the fact that I went back home and I felt that, observed that there's not a lot of women surgeons around me, and the importance of networking and getting to understand people who you work with, building teams and so forth. So one day, I actually listened to the podcast by the AWS, and I heard Dr. Patricia Newman talking about her experience with the Association of Women Surgeons. And then I was like, is this possible? Would it be something that we would be able to do? Would I be able to connect with other women through that? And I said, we'll form a WhatsApp group. And within 24 hours, there was like over 42 women in surgery who've been joining this WhatsApp group. And then gradually the relationship developed, and the plan was that we want to get to know each other. So we went into our first breakfast in April 2018, and that actually caught the attention of everybody else. And as I said, it's a very small country, very small society. And from there, things evolved, and Dr. Salman Al-Sabah, at that time, he was he is currently and was the president of Kuwait Association of Surgeons, which was founded in 2016. And he asked me that their second conference is upcoming, and he asked if we were interested to have a women's session into that conference. Of course, that was a great opportunity, and we moved forward with that. And at that time, we really didn't have a lot in terms of data and research that we could have that addresses the women surgeons in Kuwait. So we had a few months to really work hard to try to know more and inquire and find what do we have, for how long women have been there, and what are issues and challenges. And that actually led to the formation. So after on that conference as well, Dr. Patricia Newman was invited, and she was there, attended our conference, and that was really put the spirits very high up. And then the women were very enthusiastic. And then we moved forward and submitted a letter to the Kuwait Association of Surgeons to have a Women Surgeons Committee, which got approved. And in February 2019, it was officially formed. So we're like 3 years on. Now, that is being said, we was just with our start, getting involved in all this, setting up the research program, the Women Surgeons Research Network, as well as the mentorship program, and getting very active in all the roles and getting all the scientific programs running, within just, we got in the first year, we got in the first Women Surgeons of Kuwait conference. And at the same time, we held the first Women Surgeons of the Gulf meeting. And that was a historical moment for everybody in the Gulf, because it wasn't only about the women in Kuwait, but in the whole region. And we came up with the recommendations. And from that time, we have been working very closely with all our colleagues in the Gulf and moving things forward. Now, shortly after that, as you know, the pandemic hit, and the COVID-19 did not stop us from moving forward with our mission. The women surgeons, as well as myself, took this very seriously. We have worked through the pandemic in all fronts, in the clinical fronts, for example, being an intensivist and a surgeon. So, serving in the critical care, taking care of COVID patients, but at the same time also noticing the gap that, for example, most of the attention was focused on the medical patients, and then it was very important to address the surgical patients as well, and therefore forming or writing the guidelines as well, and then being involved in at the national level to educate about COVID, continuing with the research programs and the mentorship programs, and continuing to work with our colleagues in the Gulf as well. So we have the second woman of this, the first Saudi, the first surgeons, group of surgeons in Saudi Arabia have their conference through online during the pandemic, and then and the second Gulf meeting at the same time, and then the third Gulf meeting, and the first for the United Arab Emirates. And now currently we have a great movement, not only for the women in surgery, but also in medical students who have like in three countries. We have in Kuwait, in United Arab Emirates, as well as in Bahrain, medical students who are working hard to push women forward in surgery. So I'm gonna close up to allow the other speakers to share their view as well. And I want to say that discussing some of the challenges and the opportunity, some of the challenges that came across my path, trying to look at it differently and coming up with more opportunities rather than just seeing them as roadblock. And with that, I would conclude, and I would say thank you so much for this opportunity.
I have Dr. Sandra Wong. We are so happy to have her here. Dr. Wong is the William and Bessie Allen Professor of Surgery and Chair of the Department of Surgery at Geisel School of Medicine at Dartmouth. She is the Associate Editor for Annals of Surgery and the World Journal of Surgery, as well as the Deputy Editor for Annals of Surgical Oncology. As a surgical oncologist and health services researcher, she has a long record of funding from the NIH, the Agency for Healthcare Research and Quality, and the American Cancer Society. Dr. Wong has published over 270 manuscripts and book chapters. Dr. Wong is passionate about the education and mentorship of surgeon scientists and has been honored with numerous medical student and resident teaching awards. Dr. Wong is a past president of the Society of University Surgeons and the Society of Surgical Chairs. She is the president-elect of the Society of Surgical Oncology. Dr. Wong, welcome, and we look forward to hearing from you.
Thank you for that really nice introduction, Dr. Ferzandi. I'm going to share my screen. I just have a few slides, I think mainly because I think some demonstration of data may actually be really important for our discussion. So first, I just want to thank the American College of Surgeons and specifically the Women in Surgery Committee and the International Relations Committee for putting together this really great series of webinars and for inviting me to speak on pathways to leadership. I really enjoyed hearing from Dr. Al Rashed. I have to say, what an inspiring story, and I really look forward to our panel discussion. I think it's pretty cool that we represent, some different views and maybe slightly different stages of our career. So I really do look forward to our panel discussion. I'll start with the caveat that this is my story and probably doesn't represent a playbook for anybody else. Like many of you, I've encountered certain challenges during the course of my career. I think I may or may not have navigated all of these in the most optimal way, but I will say that everything is a learning opportunity. I always endeavored to learn from all of my experiences, good and bad. So I just hope that maybe sharing some of these experiences is helpful to some of you in some way. By way of very, very brief introduction, because I think sometimes it's important to know people's history. I'm the daughter of immigrants. I'm sort of a first generation college student. And I really have to say, I think my parents sacrificed a lot for me and my siblings. Really fortunate that they really valued education and really supported everything that I wanted to do in terms of going to college, going to medical school, and pursuing this career. I don't think I always knew I wanted to be a physician, much less a surgeon. And again, it was just this really fascinating experience of going to college, really finding that everything was so interesting. I majored in cell biology and minored in business. My dad's a small business person. And I just really kind of fell in love with science and fell in love with thinking about how we could use science to help people. I think pretty traditional way of thinking, certainly not everybody, but I think fit a lot of people who were pre-med in those days. And I went to medical school, not really thinking that I would like surgery as much as I did. And in fact, I liked it so much that it really became pretty apparent pretty quickly that that was the career path I wanted to pick. You know, very fortunately, there were quite a few senior women residents who ended up being really just great role models in terms of having that can-do attitude and really seeing that it was possible. And I really do think that that representation matters a lot. Very cognizant of the fact that at many other programs, there may not have been so many women in the residency program, especially, way back when. So I always remember that, and I was always grateful for that, and I always try to be supportive of other women who are looking at this and may or may not be convinced that they can do it. I think some of these slides may be interesting to see. I think some of what might be interesting for discussion is thinking about women in academics. And this slide, courtesy of the AAMC, or the Association of American Medical Colleges, demonstrates all women in medicine. And you can see, at most medical schools now, we're at parity. And a lot of medical schools were well above that 50% mark. But you can see that over time and over the course of a career, women are less represented. I think this will change. I think as we get more and more women into medical school, these numbers will change, but it's going to take some time. I think importantly, because this is a talk about women in surgery, I think it's important for us to look at these numbers. I think that we know that less women choose surgical residencies. This number is really for general surgery. The numbers are even lower for some surgical subspecialties. I think slightly fewer women choose career paths in academics. And I think as we go through the ranks of promotion, that number gets smaller and smaller. And when you get to that department chair number, it's a pretty low proportion compared to all of department chairs. But I will say that things are changing. There are 24 women chairs now in the US and Canada, and preceding us were a lot of other women chairs who've moved on to different roles. So I will say that we've all been really fortunate to have this path and to have other people pave that pathway for us. I really anticipate that in the coming months and years, there will be more and more women moving up in the ranks of leadership in academic surgery. And that's exciting. I will note, because this is an American College of Surgeons webinar, that in terms of women who are fellows of the American College of Surgeons, it's like 12%. But the most recent initiate class, it's 27% of those initiates. So I think progress is being made. We will continue to push. And I think it's really important that we are well represented in a really supportive organization. So, I think two main themes that I'll comment on. One is leaders and then leadership. And I think I'll wrap my comments first around being surgeons and being leaders. I think as surgeons, we are leaders, and it actually, that's true from the day we start residency to current day. And I think as surgeons, we really have to be leaders. Our patients really depend on us, and the care of our patients really depends on us leading our multidisciplinary teams. We face complex situations every day. We face complex situations in the operating room, when we see consultations in the emergency departments, and quite frankly, in our clinics. Our patients are complicated, and we need to take that opportunity to lead our teams. And these can be big roles or smaller roles. And our patients really depend on how we choose to show up and how we choose to lead for them. And that leadership can manifest itself in clinical care, really important. It can manifest in how we take our learnings from clinical care, the questions that are generated from clinical care, and how that can inform our research and how we move our field forward. This includes quality improvement work. This includes work that we do in clinical research, and it includes work that we do in our basic science labs. And that's all of us. So I will say that I think surgeons are ones who drive change. We strive to change the course of a disease process by what we do. I'm a surgical oncologist, and I think that one of the reasons I was drawn to that field was because I was so inspired by cancer patients. You know, people's lives change with that diagnosis, and it's oftentimes devastating. And those diagnoses can be very complex. It really requires working with different teams of people. And I really found that to be what I wanted to do. I think providing care when we could provide it, and providing hope when cure wasn't possible. So for me, that really informed my career choice. And I would say that that career choice also informed my research pathway. I think looking at patients and thinking about how we could improve care, a lot of it was thinking about how we gather data, how we look at that data, and how we change care. I'm a health services researcher, and one of the reasons that that is something that I'm so passionate about is because it is really about looking at ways that we deliver care and how we deliver surgical care and how we deliver surgical oncology care. You know, that's really one of my big focuses. So I do think that as surgeons, we are leaders, and we are leaders in multiple facets of our job. In my role as an academic surgeon, I think that offers different definitions. And I guess I'll use that to talk about leadership. And, you know, leadership is a little bit different than I think when we think about daily, our role as leaders in our daily life. When it comes to more formal leadership roles, I think oftentimes there is an inflection point when you realize that that might be something to pursue. And certainly leadership doesn't happen overnight. I would say that I didn't always know that I wanted to be a leader in academic surgery. I didn't always know that I would be a chair. But I think it became obvious when I started looking at how I wanted to approach my life. It really became a point when I discovered that it really wasn't about me anymore. It was really about others. And it was really about how I could help others be successful in what they do, whether it be about patient care or research, or really about my department and my institution. And I think that was really what sort of drove me to start looking at leadership roles and thinking about the paths in leadership. And, you know, I think oftentimes it starts small, you know, a smaller team, a smaller unit, and then thinking about how we're better together. And that grows into bigger leadership roles. You know, I really think one of the great things about being a departmental leader is being that servant leader. It really is about moving things along path. And sometimes that requires some patience, and sometimes it requires accelerant. And I think sometimes thinking about when it's appropriate to be patient, and sometimes, you know, being patient and being strategic and being methodical, and sometimes when it really requires a little bit of acceleration. You know, I think Dr. Al Rashed talked about, you know, things that she did to accelerate things with women surgeons in Kuwait. And I think that's an example of being an accelerant. I think sometimes when you're thinking about, you know, how you build a program, sometimes that takes a little bit more plotting and you know, it's hard for all of us to be patient, but I think for certain things, patience can pay off because it does take a little bit more data gathering and a little bit more strategic planning. You know, I think in terms of thinking about mentors, if you're thinking about leadership roles, I would say take the help. I think mentorship comes in all sorts of different ways, and it really requires a team. And I think that, like all teams, you can learn different things from different people, and it's up to us to think about who you want on your team, your personal advisory board, if you will, and think about what you can learn from each individual person. I try to learn something from everybody, and I think that everybody has something to teach. Sometimes it takes parsing out But I think ultimately we are better when we find those mentors who are pieces of gold for us as we're putting together a bigger mentorship team. And, it comes in different forms. And I think it's always important to be on the lookout for different types of people that you might add to your mentorship team. I think oftentimes when we think about leadership, we talk about what it looks like around seats around a table. And I think people who think about things as a zero-sum game don't necessarily help us advance, right? Because it means if we get a seat, somebody else loses a seat. I think that's not necessarily the optimal strategy for advancing women in leadership. I think there's those who believe in incremental change, pulling a chair up to the table. But I think when you're really thinking about game changers, it's about changing the size of the table and buying more chairs. And I think really, as we're thinking about kind of leadership, especially for women and for HeForShe, really, it's about finding those allies who will think about how we change the game. I'll spend a few brief minutes just thinking about leadership in professional societies. I've been so fortunate to have those roles. I would say my kind of key lesson in all of that is to say yes. I think a lot of times we think about ways to say no, but really I think involvement in professional societies is about saying yes. It's about a commitment to different groups, thinking about which groups you might have an affinity toward. Oftentimes these groups support a mission or a passion that we believe in. And it really is great because it gets you outside of the walls of your institution. It gives you a regional or national group to lean upon, gives you ways to find camaraderie outside of your daily team, if you will. But I would say that to grow in leadership opportunities in these societies, it's about saying yes. I understand these are volunteer opportunities, and so you have to be mindful of your time. But contributing and engaging leads to service to an organization that hopefully you believe in. And ultimately that service is what builds the pathway to leadership in those societies. So I would say some of this work has been the most satisfying of my career. It's led to lifelong friendships and lifelong colleagues. So I would say that, it's really about saying yes. It's really about being visible sometimes and affording the opportunity to mentor and sponsor others. So I guess I'll cap my comments there. I really just look forward to a conversation, and I really encourage people to put questions or comments in the chat box. So I'll turn it back over to Dr. Ferzandi. Thank you so much.
Thank you, Dr. Wong. I was furiously taking notes during both of your commentaries. I mean, I have questions, but I do want to definitely go to the chat. There are a couple in here, but what I'd like to do also before I get to the first question here is, one of the things that we look back on as we continue to get a few gray hairs is we've learned lessons. We've learned a few lessons. And as you've gone through your career path and achieved so many successes, what might you kind of turn back and tell your 25-year-old self in the past, the roadblocks or perhaps some of the challenges or just some of the mistakes you may have made and go, gosh, I wish I'd navigated that differently. Maybe it would have been easier this way. And Dr. Al Rashed, I'll have you go first, if you can put some thought to that, and Dr. Wong, I'll have you follow, and then I'll take a look at what's going on in the chat as well.
Okay, so I think if I am to answer this question, I would probably say to be patient and to take it easy a little bit. I think if I'm going to look back in that long, I think the enthusiasm and the eagerness to be able to to achieve and do and participate and all that, I think sometimes put your expectations, your expectation may be very high. So I think managing expectations reasonably, not actually pushing yourself down, but rather to have a more realistic timeline for the things that you would want to achieve. That would be one of the things I would say. And I think as well, as Dr. Wong mentioned, taking help. Sometimes we often want to do everything all by ourselves, and whether taking care of all the little details, or you don't want people to think you cannot do it, or you're weak, or this or that. I'm talking about many years ago now. But it is something that I would say, if you get help, if you needed help, it's okay to accept it. And I would throw one thing here is that I wished I had a mentor. I wasn't aware what is a mentor back then. And again, the maturation of the experience when you want to talk about surgery in the United States or in Canada, and then back here in the region, the evolution, that played a role, right? So by the time then when I wanted to be a surgeon, not really a lot of women were there, or if they were there, there was no social media, there's no exposure to who are these women. Women started to be in the surgical, started to have surgery like in the 1980s. So just to be, for the audience to understand and have a comparison. So like in Kuwait and Kingdom of Saudi Arabia, the women started to enroll in surgery, like few women as well. It's in the 80s. So just, so I think these are the things that I would tell myself back then.
Well, those are really priceless tidbits. I would say that it took me a long time to give myself a break. And I think that reflects some of the comments that were just made. I think we all hold ourselves to such high expectations. I think that it's okay. We can give ourselves a break. You always have to stay hungry. You always have to kind of keep thinking that the second you think you have it, you're probably behind. So you should always maintain that. But I think it's okay to give ourselves a break. We set such high expectations for ourselves. We will always have high expectations. But I think it's okay to not be on 100% all the time. It's not sustainable. It's really not. And I think we do better if we're able to be realistic and set those really kind of reasonable expectations. We will always have forward progress, but I think the pace and kind of the thought behind the acceleration, that we don't have to be on all the time. I think you can have days where it's really fast, weeks where it's really fast, but it can't be that way all the time. And I think that's about sustainability, and that's about recharging so that we can be really fresh. We know we are better when we're in that frame of mind.
Dr. Wong, one's going to be towards you, and I think you may be able to answer it quickly, and then I'll go to the next one. An anonymous attendee is asking if you are aware of your university having any free online certification degree programs related to surgery or urology or ethics, but surgical leadership. I mean, you can answer about if Dartmouth has something like that, but I know that a lot of our professional societies offer those types of opportunities, as you mentioned, getting involved in professional societies like ACS. So I don't know if you have anything specific to surgical oncology that you can offer.
Yeah, I wouldn't say that directly through Dartmouth, but there are a lot of opportunities. Unfortunately, a lot of them do require membership or fees. But I think that's changing. I think one of the things that we can take from the pandemic is we now have these webinars, which are, we've really learned how to be virtual. So I'll take a look at the question in the chat. I don't have any kind of ready answers, but definitely there are resources to be had. And, there are increasingly more and more virtual opportunities.
Dr. Al Rashed, I want to ask you something that, I think we all deal with, and I know in your situation, as you've alluded to, is probably much harder. But you mentioned that, when you went back to Kuwait after your training, et cetera, you were dealing with a hierarchy within a hierarchy. And, speaking from my own experience, we deal with hierarchies, and we're constantly trying to, as Dr. Wong said, pull that chair up to the table, kind of elbow our way in and see if we can get a seat. Can you elaborate a little bit on your struggle specifically with the hierarchy and how you were able to kind of make some inroads?
Okay. All right. So as I explained earlier, the systems are slightly different. So when you want to talk, for example, getting back home, you're being board certified and have fellowship, you get back in. The way I know it, when I was a resident, you're an attending, so you're an attending, you go there and you pursue your work. But the promotional system is slightly different back home, and it involves, in addition to your certification, amount of years. So It's more of a timely base, and promotion to promotion, it's a time that you needed to wait. This is one of the things. In addition to that, there is, for example, a specific number of CMEs. There's no research, for example, that is required or certain things. So that kind of, and then when you wanted to go and you fit the criteria, still you would not have received that promotion. It will get delayed for no good reason. You will be like running around chasing your tail with bureaucracy. And that's what I say. And then, so that is one aspect to it. And then once you get that as well, so when you finish as attending, you can be an attending and work in a hospital, for example, in the state, whether you want to go to the university and be assistant or associate professor, etc. So there's like that academic. But if you work in the government hospital, your roles and clinical responsibilities slightly differ. When you just finish your board, then you are what we call a senior registrar. A senior registrar is equivalent to somebody who have their board. Now, technically, these people can work within their specialty and supervised. But here, no, then there's a specialist, and then a senior specialist, and then there's a consultant, and it's all time-based. And then within the same team, there is, so you can imagine when you take a decision, clinical decision, the things that you need to go through where sometimes it is really inefficient to go through that. So this is just a quick brief, and you might not understand that. So this is when it comes, for example, to clinical work, and then there is administrative roles that in certain positions you will be able to work on these roles. And then there is working in Kuwait, for example, you can work in the governmental sector if you are a Kuwaiti, but also you can do part-time in a private hospital. Now, if you are to do that, you need to be at least a specialist. So if you are in a senior registrar, you cannot work unsupervised. And there's like more into that. So what I'm trying to say here is that kind of hierarchy sometimes does not really give you the most efficient clinical work environment that you need to like be able to fulfill. And sometimes it has an advantages because, as I said earlier, the training programs, not having like the university, the structure itself may result into some fragmented experience. So, you could put that system to sort of protect or compensate for competency issues with in terms of outcome for graduates. So it's a bit complicated to explain, but I'm trying to say, just coming from a different culture to a different culture, just understanding like, what am I supposed to do here? Is this, and then, you could have issues that raise, or like you're doing a great job or this and that. So that, it took a while to understand that part.
I think that's one of the biggest challenges, just understand the system you're walking into and then learn how to navigate it. I think that's where the patience comes in before you start trying to accelerate kind of your own pathway. Dr. Manchanda has a provocative question that I think is worth posing. As we continue to forge these roles for women that we know are well deserving, is there a role for saying almost like reserving spots, say at the table, in the boardrooms, in leadership positions for women? I mean, how do you feel about that? Like, I know that there would be obviously some pushback, but is that a good idea, or do we just continue to push forward and get clinically sound and keep getting our dossier filled and filled and filled? Like, what's your take on that? Dr. Wong, I'll start with you because I think you've probably dealt with this a little bit more.
Yeah, it's a really great question. Rather than setting, specific numbers or quotas, I would kind of think that this is really more about intentionality. Like, we need to be much more intentional about how we do things and how we think about things. And rather than, setting strict numbers or strict criteria, I think it's really about being intentional. And who's to say that 50% is the right number? Maybe it's 60%. Maybe it's 70%. But until we start thinking about this very intentionally, I don't think that we will get there. I'd be curious on your opinion on that. I think of it really much more broadly than kind of 50%, because honestly, maybe that's not the right number. We know we're nowhere close to that right now, but who's to say 50 is where it should be?
Or where we ever want to settle, right? Dr. Al Rashed,
Yeah.
How is your effort in Kuwait being perceived, say, by the more within physicians outside of the surgical field? I know you've created this little cohort of women surgeons and you're advancing it across the Middle East. How is the perception, and are you battling a perception problem with a lot of the biases that we know we face here and in other parts of the world for women surgeons, let alone women physicians?
So far, the experience is actually very positive. I think our experience really, I don't want to say change the game, but actually make it more like made everybody more enthusiastic, even men, to sort of push things forward as well from the society point of view. I do feel that there is more awareness now when it comes to the roles of the associations and what are the things that they can offer and what are the things that they can provide. I mean, if you want to look at the experience in the medical, for example, in Kuwait, the Kuwait Medical Association was founded in 1963, and then that was serving everybody. So there's like almost 11,000 to 12,000 physicians all in Kuwait, and they're all members in that association. Now, Kuwait Association of Surgeons is founded in 2016. So if you want to see the time that required or building the numbers and the expertise with the surgeons, realizing that we have maybe different needs than what the medical association would have, in alignment. But I'm saying we do have our special things that we want to advance. So I think through our efforts, I think the experience was positive. And as I said, through our research network, we did collaborate not only with people in the medical field solely, but we have from pharmacology, from dentistry, so even outside being just in medicine or in surgery. So I think the experience is very positive, and I think people are seeing what are the potentials, and hopefully this will push everybody for better reformation of the whole healthcare system and the culture as well.
I want to also bring up something provocative, and I think, Dr. Wong, I'm going to address this to you as you usher in a lot of younger faculty. I really liked what you said about learning when we need to be patient, because there's a lot of plotting we have to do to develop divisions, our careers, whatever. And then there are times we need to add a little accelerant to that. One of the challenges a lot of women will face is when they become a little bit more, shall we say, deliberate in their actions. They get very easily labeled as difficult to work with, not easy to collaborate with. I mean, how do you advise young faculty if that starts happening on navigating that so that they don't end up being sabotaged or sabotaging themselves? Any thoughts on that? And I know that's kind of a heavier question, but I think a lot of young women face that a lot.
Yeah, it's a really critical issue, and thank you for bringing it up. I think a lot of this depends on knowing yourself, right? So so some of it is knowing yourself and knowing what triggers you might have and what things are motivating. So I think a lot of it is just developing some self-awareness about things that will work for you and things that don't necessarily work for you as an individual. That being said, I do think that we have to think about ways to support ourselves and support each other. So I would say really everybody needs mentors. So look for those mentors, look for people who, can really support you through all that. Find sponsors, find people who are allies. I think it's really unfortunate when labeling happens. I think that those stereotypes certainly do hurt people in terms of advancement. One way to kind of, insulate yourself from that or really potentially rise above it is to find people who can support you in that. Right. So it really takes a team. I think it takes people who support you in different ways to navigate outside of that. You don't want to be in that lane. And it's really unfair and unfortunate when that happens. And I think the way to navigate that is to get out of that lane, right? To get out of being labeled as being difficult. Nobody intends to be difficult. I always assume positive intent, and you need to find people who also assume that positive intent and who can help you get and rise above, that classification or that misclassification. People are out there. Again, I harken back to the name of this webinar. It's HeForShe. Those allies can be other women and it can be men. And it requires all of the above. And it really requires having a team of people behind you. There's no magic answer.
No,
there's
and
no
I
magic
think,
answer.
but I think we have to
this.
keep reminding ourselves, absolutely. And I think finding those allies, and sometimes you have to think outside of the box. Your allies are not necessarily people directly around you. They can be outside of your department, outside of your institution, outside of your country. And I do think that's an important point. We are going to start wrapping up, and I would like to kind of think if you have any closing comments or pearls of wisdom that you'd like to share with me and the audience, it would be appreciated. Any take homes that you'd like us to take from today?
Thank you so much for having this webinar. I think it's a great short, it's an hour, but it's a nice way to develop some community and to understand that we're not alone in this. That oftentimes in and of itself helps. So thank you so much for including me. And if I can be of help to anybody, even if it's just a chat, please let me know.
Thank you, Dr. Wong. Dr. Al Rashed, any parting thoughts, so to speak?
I really would like also to echo Dr. Wong and say thank you so much for the American College of Surgeons. We as an organization, we all believe and know the impact that it can make worldwide on all surgeons, and everybody who aspires to be a surgeon. So I think just the fact that they are taking this issue to this level and educating others and having these webinars. I think these efforts, I'm really happy that, the leadership actually seeing the importance of this. And I think, doing that is actually setting the path for all women and men, because I do actually believe that we together make surgery better. We together reform if we wanted to go ahead and do that. Taking the lead on this definitely will make it even more visible for those allies that Dr. Wong was speaking about. We do need more allies, men as well as women. So I think setting this up definitely by itself is a great thing to be done. And I'm very happy to be a part of this, sharing my experience and the experience of women surgeon, and hopefully continuing the journey, forming more friendship and networking with surgeons like you and associations like you. Thank you so much.
I really want to thank both of you. And I can't dismiss the last comment that just came up in the chat. It was from an anonymous person who obviously wants to be anonymous, but how do you deal with being sabotaged by a fellow woman surgeon in a department? That's where the knife hits you, right? And I think the take home from both of your talks today, find your allies, get out of your lane. I love what you said, Dr. Wong, get out of your lane, find other allies, and understand why the sabotage might be happening, but then garner your own troops and your allies to show the good work that you're continuing to do. And you may have to go outside of your department. I think these are the things that happen to us. I think being a woman is hard. Being a woman is hard. Woman surgeon is even harder. But we need to continue to look at these success stories. And I really applaud and thank both of you for your time today. And the sun's rising on one side and the sun's setting on the other. I really sincerely thank you. It's not gratuitous. And I would be remiss not to thank the American College of Surgeons, the Women in Surgery Committee, and the International Relations Committee for constantly pushing this narrative forward to really talk about how we can promote women in surgery and beyond. Dr. Sharon Stein, Dr. Susan Porres, and Dr. Abdelaziz have been real mentors to me as well, and promoting this. So Dr. Sandra Wong, Dr. Asmaa Al Rashed, Dr. Jenny Mohan from the ACS and the staff that made this all happen. I really appreciate it. And I bid you all a good Thursday. Thank you so much.